she is not coming.
हैप्पी इवनिंग मैडम। देर आए दुरुस्त आए बोलते हैं।
Happy evening, sir. Hi, Dr. Chinmay.
Hi, Priyanka. Please close all your videos and audios. I'll play the video.
Happy evening, viewers. Welcome to another episode, that is the 24th Garbha Sandesha episode. It gives us immense pleasure that we are gaining popularity due to the rise in viewership. And in continuation with the Garbha Sandesha episodes, today's episode will be on how to make IVF successful. And to talk on this, we have Dr. Chinmay and Dr. Priyanka Rani. Dr. Chinmay, who is an MBBS, MS OBG, and a FRM, is a fertility expert with 8 years of experience in gynae and obstetrics. She holds a fellowship in reproductive medicine from RGHS. Dr. Chinmay has a compassionate and caring nature. She practices at Garbhagudi and is recognized for performing IUI, in vitro, and other such ERT techniques. Her mission is to provide the highest medical care to all of patients. Dr. Priyanka Rani is a fertility specialist with years of experience in gynecology and obstetrics. She holds a FRM degree from Rajiv Gandhi University of Health Sciences. She is well versed in all the procedures of ERT. Dr. Priyanka is eager to commit herself to our patients, providing them with assurance which puts them at ease during their treatment. Her skills as fertility specialist made her a valued member of the team at Garbhagudi IVF Center, Electronic City. Now, I'll start my questionnaire with Dr. Chinmay. Madam, why do many people undergo IVF these days? And what factors determine the success rate of an IVF procedure?
So the various indications for IVF, that is in vitro fertilization. So again, it can be divided into two groups, indications related to female factors and indications related to male factors. So if we want to talk about female factors, what can lead, who are those group of people who requires IVF? Are like those whose tubes are completely damaged. That means if the fallopian tubes are damaged and completely blocked, then the only option they have is to go for IVF. Or those who have had previous ectopic pregnancies where the tubes have been removed. In such cases also they'll require IVF. And those who are elderly women, more than 35 years, married for more than 10 years, will require IVF. Along with that, those who have less number of eggs, or what we call as low ovarian reserve, or those who are suffering from low AMH values, or the ones they will require IVF. Similarly, if we look at all those who have severe endometriosis and previously they have experienced multiple IUI failures and previous multiple miscarriages where a known genetic cause have been identified, such people will require IVF. Similarly, even in case of males, those who have severe male factor infertility, meaning those who suffer from severe oligoastenoteratomy, the count is less than 5 million, or the normal structure of the sperms are less than 1% or 0% it is, or when we see that the motility of the sperms are zero, where we call it as necrozoospermia, or in case of those who have very high DNA fragmentation in sperms, say like it is more than 35-40%, or in cases of azoospermia men, then also the IVF or ICSI procedure might be necessary. And in some cases, what we call as unexplained infertility, where they have not conceived through multiple IUIs, they will require IVF treatment. If we look at what are the factors which can affect the pregnancy rates for the various factors, I would like to name a few which play a major role in contributing the success towards IVF. Like the age, once the women's age is more than 35-40 years, then the success rate of IVF will drop down, because it can affect the oocyte quality and also the embryo formation. Because of these reasons, it can affect. And second thing is any other contributory factors like history of endometrial tuberculosis, or if there is a very severe the endometriosis, or in cases of genetic abnormalities, all these things can have an impact on the success rate of IVF. Of course, there are various newer advanced technologies where we have been trying to overcome all these factors and to provide maximum pregnancy rates to our couples.
Thank you, doctor. Before I move on to the next question, I would like to inform our viewers that due to Mother's Day celebrations tomorrow, in all our 5 centers, there are certain offers. The first free fertility consultation will be offered. And then along with that, 20% off on semen analysis for men and 20% off on select blood investigations for women. I advise all our viewers to take this opportunity. Now, Dr. Priyanka, is it possible to forecast probability of IVF success based on tests performed before starting the IVF treatment?
Yes, as Dr. Chinmay has correctly elaborated all the causes, and it is very difficult to individualize, and whoever come for IVF, they must understand that there are no standard percentages. Like, I cannot tell that it is 50-60% for every couple who walks in. So it majorly depends upon the woman's ovarian reserve. So a lady who has low reserve, so how do we know that? Is by doing a AMH test or by doing FSH test. So if the AMH is low and the FSH is high on day 2 or day 3, so such woman can expect a little lower success rate than other women. And when there are other contributory factors also, like if there is a fibroid, there is endometriosis, or there is a severe male factor, or there are other medical conditions which can impact fertility. So based on that, each individual has a different success rate. And that is what the couples who come for IVF must understand, that when they come for counseling, they must ask their doctor what would be the success rate based on their conditions and based on their test results. So undergoing the basic tests are very important for us to analyze and then tell them whether an IVF is really required and what would be the success rate for that couple.
Thank you, madam. And Dr. Chinmay, what is a short cycle IVF and a long cycle IVF? Does the success rate depend on choosing either of these variants?
So when we do IVF for patients, the various protocols that we follow, the way that we give injections, the way we continue the cycle, on what day we start. So all those things depend from protocol to protocol that we use. And we don't follow a standardized protocol for everybody. So what we would do is an individualized protocol, what that particular patient or female requires based on her previous history, whether she's undergone previous treatment or not, what is her ovarian reserve, how she has responded in the previous other treatment protocols. So and what could be the best success rate, depending on her parameters, we will decide what kind of protocol suits her the best. Like that, we have various long agonist protocol, what we call that we use some only in a very small subgroup of patients who have low ovarian reserve, or in one case of endometriosis. But again, they require very high dose of injections, say, when we do that protocol. And if we see their response will be a little slower. But if you look at the final pregnancy rate compared to the other protocols, it's more or less the same, just that a little cost might go higher in them. Similarly, when we do another protocol called as an antagonist protocol, even in them, the results are almost comparable with the other protocols. And only thing is they require lesser amount of gonadotropins. So depending on what condition the patient has and how she has responded in the previous, what is her body weight, and what is her ovarian reserve, plus her day 2 FSH values. So all these things will help us determine the kind of protocol that requires for her, with which we can give the best results for that particular patient. So it is what we follow is an individualized planning of IVF than doing a standard single for everybody, which might not suit for every other patient. So of course, success rate, which gives the best success rate for her parameters, will be chosen, and that would be the ideal for that patient.
Thank you, doctor. I would like to remind our viewers that these topics are their choice, and if they have a particular choice of topic on which our specialists should speak or explain, please mention that in our comment box. Next Garbha Sandesha episodes will be based on those topics. Now, Dr. Priyanka, is there a possibility that success rate of an IVF treatment gets affected by using fresh embryos and frozen embryos for the procedure?
So first, I would like to highlight what is a fresh embryo transfer and what is a frozen embryo transfer. In fresh embryo transfer, the IVF cycle is done, like the injections are given, the eggs are matured, the egg pickup is done. Once the embryos are created, they are transferred as soon as the embryos are ready. 2 or 3 embryos will be transferred either on day 3 or day 5. So that is a fresh embryo transfer. In a frozen cycle, whatever embryos are created, they are frozen, and then subsequently the endometrium is prepared, and that is when the transfer is done. So in fresh cycle, because the injections have been given, sometimes the hormone levels of called like estradiol, the estradiol levels may be very high, sometimes the progesterone levels may be high. So in such cases, the endometrium, that is the inner lining of the womb, may not be very favorable for a pregnancy. So very often and across many centers in the world, they have found that the results are much better with frozen transfer cycles than fresh. However, it would definitely depend upon individual women parameters. And most of our cycles, majority are frozen transfers because we've got very good results. It is a very controlled cycle. We can correct many factors. We can control the endometrium. It can be timed in a beautiful way. When the blood flow is perfect, at that time the transfer can be done, which factors cannot be controlled in a fresh transfer cycle. So we would prefer to do a frozen cycle, but again, in few conditions, we do consider fresh cycles.
Thank you, doctor. Very nicely explained. Dr. Chinmay, is it possible to predict the success rate of an IVF procedure based on pre-genetic diagnostic tests to some extent?
Yes, sir. Now we have various newer technologies called as pre-implantation genetic testing, where we can test the genetic status of the embryos. So in that we have the tests are called as PGTA or PGTM, PGTS, and also we do something called as embrace. Meaning, instead of just biopsying the embryos, we can take the fluid around the embryo and send it for genetic testing. So these kind of tests are not required for all patients who undergo IVF. It is again only a selected population requires this, like those who are more elderly, like more than 35, 40 years, where risk of having a chromosomally abnormal embryos are higher. So they require this test. Or those who have an abnormal genetic report, so in them it is necessary. Or those who have had previous multiple miscarriages, or those who have tried multiple IVFs and it has not worked out, they have had many negative causes. So these are, or in cases of severe male factor infertility also it might be required. So only in these patients it is required. And how it improves their pregnancy rate is many a times, even if like how we choose the embryo. So generally we choose based on the morphology. That means we look for certain features in the embryo and then grade it. So the grade A embryos are the ones which are usually transferred, the top quality embryos. Sometimes in small group of patients, even though to see the embryos look absolutely normal, but we only assume that the genetic component of the embryos are normal. But unless we test, it is not possible to tell about the genetic status of the embryos. It is only through these tests like PGTA or PGTS or PGTM we'll be able to identify what is the genetic status of these embryos. And when we know that it is chromosomally completely normal embryo and we transfer such embryos, the chance of pregnancy in these patients, those who have had multiple miscarriages or maybe multiple IVF failures in the past, will be highly benefited, because we'll be choosing the embryo based on their quality. And second thing, also based on their genetic status, that which are chromosomally normal. So their pregnancy rates will definitely be higher compared to just transferring or without doing these tests in these patients. So that improves their pregnancy rates by about 10 to 15% extra. So this will lead, not only increases the pregnancy rate, and also the chance of them getting a healthy live birth child will be also increased by performing genetic test. But as I said, it is not necessary for everybody, but it is only a small subgroup of patients who requires that. And once we do it and then identify which is normal and transfer, the pregnancy rates are significantly higher in them.
Thank you, madam. Thank you. Very well explained. Now, Dr. Priyanka, does multiple IVF attempts influence the success rate of IVF procedures?
What we need to understand here is who would require multiple IVF attempts. There are a certain subset of women who would require multiple cycles, and we cannot achieve a good pregnancy rate with a single IVF, especially women who have a low reserve. So when the overall egg reserve is less, that is the egg counts are less. So if one cycle we do, we may get 1 or 2 good embryos. We can again do one more cycle, and when we get 2 or 3 very good embryos, the success chance will improve. or sometimes a repeat IVF attempt would also help us to correct the factors which had gone wrong in a previous cycle. Like many women come to our center who have undergone IVF done outside, they've not got good quality embryos. So when we are able to analyze those factors, we avoid certain set of injections. We may plan the injection, like the trigger injection, a little early or a little late, or we may plan a different injection altogether. So slight variations in the protocol in a subsequent cycle will also improve their chances. So in women who have not got good quality embryos, in women who have low reserves, so in these women, we can expect better results in the subsequent cycles.
Thank you, madam. Dr. Chinmay, can you explain how men's reproductive quotient plays a role in determining the IVF success rates?
So even in case of severe male factor infertility, as I told before, those who have a count of less than 5 million, or where the morphology, normal structure of the sperms are very less, like 0% or 1%, or in cases of the motility is significantly lesser, less than 10%, or in cases of azoospermia, they require IVF. So in cases of severe male factor infertility, what we perform is called as ICSI, that is intracytoplasmic sperm injection, where the sperm is taken and directly injected into the oocyte for fertilization. So by doing this, the chances of fertilization is increased compared to the conventional IVF procedure. So by performing IVF in case of male factor infertility, whereas IVF or an ICSI, the chances of pregnancy can be increased. And second thing, if there is azoospermia or a non-obstructive azo, in such patients, we need to rule out if there is any known genetic abnormality which has led to this. So in such cases, when we identify that, through, as I told you previously, through genetic testing, we can identify which is normal. I can avoid such kind of genetic abnormality being carried over to the offspring, and then transfer such embryos. So all these methods will help in overcoming the male factor infertility, and they'll be definitely benefited through IVF procedure.
Thank you, madam. Chinmay, madam, please. There is a question from a prospective parent by name Sridevi Pramod. She asks, ma'am, I have very small uterus. Is that possible to increase uterus size? Any treatment in your hospital? Please tell me in Kannada language.
Okay. Sir, ಇದರಲ್ಲಿ ಈ ತರ ಕಂಡೀಷನ್ ಸ್ಮಾಲ್ ಸಣ್ಣ ಗರ್ಭಕೋಶ ಇರೋರಲ್ಲಿ ನಾವು ಪ್ರಿಮೆಚೂರ್ ಓವೇರಿಯನ್ ಫೇಲ್ಯೂರ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಅಂತವರಲ್ಲಿ ಈ ತರ ಕಾರಣಗಳು ನೋಡ್ತೀವಿ. ಅಂದ್ರೆ ಅವ್ರದ್ದು ಅಂಡಾಶಯಗಳಲ್ಲಿರೋ ಮೊಟ್ಟೆ ಸಂಖ್ಯೆ ತುಂಬಾ ಬೇಗ ಕಮ್ಮಿ ಆಗ್ಬಿಟ್ಟಿರುತ್ತೆ. ಅಂದ್ರೆ ಬೈ 25 ಐ ಡೋಂಟ್ ನೋ ಹರ್ ಏಜ್, ವಾಟ್ ಎವರ್ ಇಟ್ ಇಸ್, ಬೇಗ ಕಮ್ಮಿ ಆಗಿರೋ ಕಾರಣದಿಂದ ಅವ್ರ ಗರ್ಭಕೋಶ ಸರಿಯಾಗಿ ಬೆಳೆದಿರೋದಿಲ್ಲ, ಅದು ಸ್ಮಾಲ್ ಇರುತ್ತೆ. ನಾವು ಅಂತವ್ರಿಗೆ ಏನ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ ಫಸ್ಟ್ HRT ಅಂತ ಟ್ರೀಟ್ಮೆಂಟ್ ಹಾಕ್ತಿವಿ. ಸೊ 3 months ಆ ಟ್ರೀಟ್ಮೆಂಟ್ ಹಾಕಿದಾಗ ಅದು ಗರ್ಭಕೋಶದ ಸೈಜ್ ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ನಾವು ಇಂಪ್ರೂವ್ ಆಗೋದನ್ನ ಖಂಡಿತವಾಗ್ಲೂ ಕಾಣ್ಬೋದು. ಅದಾದ ನಂತರ ವಿ ಪರ್ಫಾರ್ಮ್ ಅ ಪ್ರೊಸೀಜರ್ ಕಾಲ್ಡ್ ಹಿಸ್ಟ್ರೋಸ್ಕೋಪಿ ಅಂತ ಮಾಡ್ತೀವಿ. ಅಂದ್ರೆ ಅಂಡರ್ ಅನಸ್ತಿಷಿಯಾ ಅವ್ರಿಗೆ ಗರ್ಭಕೋಶದೊಳಗೆ ಒಂದು ಕ್ಯಾಮ್ರಾ ಹಾಕ್ಬಿಟ್ಟು ಡೈರೆಕ್ಟ್ ಆಗಿ ನಾವು ಅಬ್ಸರ್ವ್ ಮಾಡ್ತೀವಿ. ಜಾಗ ಯಾವ ರೀತಿ ಇದೆ, ಮಗು ಇಟ್ಕೊಳ್ಳೋಷ್ಟು ಜಾಗ ಕೆಪಾಸಿಟಿ ಇದೆಯಾ, ಲೆಂತ್ ಎಷ್ಟಿದೆ ಅಂತ ಕಂಪ್ಲೀಟ್ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡ್ಕೋಬಹುದು. ಸೊ ಈ ತರ ಮಾಡಿ ನಂತರ ಅವರು ಪ್ರೆಗ್ನೆನ್ಸಿ ಆದಾಗ, ಆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಮಾಡುವಾಗ್ಲೂ ಸಹ ನಾವೀಗ ಅವ್ರಿಗೆ ಇಂಥವ್ರು IVF ಮಾಡಿಸ್ಕೊಂಡಾಗ ನಾವು ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡುವಾಗ ಒಂದು ಸಿಂಗಲ್ ಎಂಬ್ರಿಯೋ, ಒಂದು ಬೆಸ್ಟ್ ಕ್ವಾಲಿಟಿ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡ್ತೀವಿ. ಬಿಕಾಸ್ ಟು ಅವಾಯ್ಡ್ ಟ್ವಿನ್ ಪ್ರೆಗ್ನೆನ್ಸೀಸ್ ಯಾವುದೇ ರೀತಿ ಆಗದಂಗೆ ನೋಡ್ಕೊಂಡಾಗ ಖಂಡಿತವಾಗ್ಲೂ ಅವ್ರ ಪ್ರೆಗ್ನೆನ್ಸಿನ ಟಿಲ್ ಟರ್ಮ್ ಡೆಲಿವರಿ ತನಕ ಆರಾಮಾಗಿ ಕಂಟಿನ್ಯೂ ಮಾಡಬಹುದು. ಸೊ ಅವ್ರಿಗೆ ಥ್ರೂ HRT ಟ್ರೀಟ್ಮೆಂಟ್ ಯೂಟ್ರೈನ್ ಸೈಜ್ ಜಾಸ್ತಿ ಮಾಡ್ಬೋದು, ಗರ್ಭಕೋಶದ ಒಳಗಡೆ ಲೈನಿಂಗ್ ಇಂಪ್ರೂವ್ ಆಗುತ್ತಾ ಅಂತ ನೋಡಬಹುದು, ಮತ್ತೆ ಅವ್ರಿಗೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಕ್ಯಾರಿ ಮಾಡೋ ಕೆಪಾಸಿಟಿ ಎಷ್ಟಿದೆ ಅಂತ ಕೂಡ ನಾವು ಅಸೆಸ್ ಮಾಡ್ಕೋಬಹುದು.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಶ್ರೀದೇವಿ ಪ್ರಮೋದ್ ಅವರೇ, ನಿಮಗೆ ಉತ್ತರ ಸಿಕ್ಕಿದೆ ಅನ್ಕೋತೀನಿ. ಡಾಕ್ಟರ್ ಪ್ರಿಯಾಂಕಾ, like before I go to the set of questions, there is a question from the viewer. A prospective parent has asked, Dr. this is from Divya Krishna, a prospective parent. After laparoscopic, is it possible to do IUI with donor sperm? And what about success rate? Dr. Priyanka, please.
Yeah, so to answer the question, like I don't have the details, and they have not mentioned for what reason laparoscopy was done. If laparoscopy was done and they have assessed the tubes and they have told that tubes are open, the uterus is fine, the ovaries are in good shape, then they would benefit from doing a IUI. And whether or not a donor sample is required, that depends upon the sperm analysis of the husband. So if the doctor has suggested a donor sample, if there was some male factor, then they can proceed with it. And normally the success rate with IUI is around 10 to 15%. So that is what they can expect. But even in azoospermia, we can get good results by doing ICSI with PESA. So they can come for a consultation and decide whether donor sample is really required or not.
Divya Krishna Madam, our Dr. Priyanka Rani sits at our Electronic City Center. If you need further information, please do contact her or visit her once with your reports. Thank you. Thank you, Dr. Priyanka. Now the question to you. Is it possible to guarantee success rate if a woman's embryo was frozen during her fertile years, but IVF is carried out in her mid or late 30s? Priyanka Madam. You want me to repeat the question, Madam?
Yes, sir.
Yeah. Is it possible to guarantee success if a woman's embryo was frozen during her fertile years, but IVF is carried out in a mid or late 30s?
What the viewers must understand is the embryo age will remain as per the age of when it was frozen. So if the embryos were frozen when the lady was 27 years, the age of embryos remain the same, whether it has been frozen for 5 years, 7 years. So whenever they are ready for embryo transfer, both psychologically and financially, they can come for a transfer. It will not impact the success rate in any way. The embryo age remains the same. But what we must, and why I told both emotionally as well as financially, because many a times women who would have frozen the embryos or say oocytes when they were young or not married, or when they were going through certain professional responsibilities with which they were not able to give time for this. So whenever they come for treatment, they must come with a free mind, come mentally prepared, have faith, come with a positive attitude, or some women may not be in their proper weight, so they must reduce their weight and come when they are actually mentally as well as physically ready for the treatment. That improves the success rates a lot.
Thank you, Madam. I wish our ages also could be frozen. Thank you. Now going to the next question, Dr. Chinmay. What is the possibility of IVF success when the couple is habituated to lifestyle factors like smoking, drinking, or overeating?
So smoking, as you said, these three factors, smoking, drinking, and overeating leading to obesity, all three will have a significant impact on the success rate, whether it may be happening in case of females or with the males. So even when the females are exposed to or smokers or anything, that can significantly affect two parameters. One is their egg count will drop down significantly. Along with that, even the quality of the eggs can come down, because these two reasons, the quality of the egg and the egg count, once they are damaged, then that can affect the pregnant, bring down the pregnancy rate by about 20%. It can drop down. So it's very important that they should know that smoking can cause a higher deleterious effect on the ovaries also. Meanwhile, similarly, smoking also can affect the sperm parameters by reducing the count. It can reduce the motility of the sperms and also increases the DNA fragmentation in the sperms. So such sperms have got very less capacity to lead to pregnancy, because the embryo that is formed out of these sperms can have more fragmentation in them, have a poor quality. So all these, once the embryo quality is compromised, then that it will affect the pregnancy rates, will bring down the chances of pregnancy in such women. Similarly, even alcohol and obesity, they can lead to the quality issues. And secondly, what happens if the woman is obese, then her chances of requirement of injections during IVF will increase drastically. So because of high dose in the requirement, sometimes it can affect their quality, egg quality, embryo formations, and also post transfer. Once we transfer the embryos, the chances of miscarriage will be slightly higher because of obesity per se. Obesity itself can increase the risk of miscarriage in such women. And in case of men also, it affects their, it can lead to diabetes. Then secondly, it can lead to chances of they reduce the count and motility of the sperms, normal structure of the sperms can come down, and also the DNA fragmentation. So all these things will collectively affect the quality of the egg and the sperm, which in turn reflects on the embryo quality and reduces the pregnancy rate. And obesity and smoking increases the miscarriage rates in case of women, and also men who are smokers and the embryos which are created out of those embryos, the chances of miscarriage of those embryos will also increase. So all these three parameters will affect the will affect the IVF success rate. Definitely they're known to affect the IVF success rate, and they should completely quit when they're planning for treatment.
Thank you, madam. And Dr. Chinmay, like there is a question from a prospective parent. Her name is Rihan Beg. She asks, ma'am, I have asthma problem. I want to be pregnant again. Can I be or not? Please tell me, ma'am.
Yes, so the asthma per se is not a contraindication to conceive pregnancy. For to conceive, she can definitely have, I mean, as she has said, can I conceive again? I hope she's trying for the second child now. So if she's trying, she can definitely try. But now there are various newer medications as simple inhalers, which she can use regularly, which has got only local effect, where it will not affect the baby or the pregnancy that is growing inside, because it acts only on her lungs. So even if she's having any acute exacerbations or any acute episodes of asthmatic attacks, she can use those inhalers, which would be beneficial. And there is definitely no contraindication for her to plan her pregnancy.
Thank you, madam. Thank you. Dr. Priyanka, is there a possibility for women with ovulation disorders and conditions like endometriosis to achieve a successful IVF pregnancy?
Definitely, these are actually the clear-cut indications for IVF. Women with endometriosis, they do very well with IVF treatment, and especially those who, in women with ovulation disorders who have not been able to achieve pregnancy with either normal ovulation induction or IUI. In them, we can achieve very good success rates with IVF, especially if the male factor is normal. So they must, if other treatments have failed, they must think of going for IVF and get the proper consultation done at the earliest.
Thank you, madam. Dr. Chinmay, there's another question. Kannadadal kelidare, like she is telling, Sunita is the prospective parent. Hi, ma'am. IVF BHCG positive bandide, but 5 weeks pregnancy IVF, but small bleeding hogta ide. Idu yak agutte, ma'am? Please solution.
So the 5 weeks ಅಲ್ಲಿ ಬ್ಲೀಡಿಂಗ್ ಆದಾಗ we need to perform scan ಮಾಡಿ ನೋಡ್ಬೇಕಾಗುತ್ತೆ ಎಲ್ಲಿದೆ ಬ್ಲೀಡಿಂಗ್, ಎಲ್ಲಿಂದ ಆಗ್ತಾ ಇದೆ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಅಂತ. ಸೊ ಮತ್ತೆ ನೀವು ಏನ್ ಮೆಡಿಸಿನ್ಸ್ ತಗೊಳ್ತಾ ಇದ್ದೀರಾ, ಕೆಲವು ಸತಿ ಪ್ರೊಜೆಸ್ಟ್ರಾನ್ ಸಪ್ಲಿಮೆಂಟ್ ಸಾಕಾಗಿಲ್ಲ ಅಂದ್ರೆ ಅದನ್ನ ಇನ್ಕ್ರೀಸ್ ಮಾಡ್ಬೇಕಾಗಿ ಬರುತ್ತೆ. ಅಥವಾ ಕೆಲವು ಸತಿ ನಾವು ಬ್ಲಡ್ ಥಿನ್ನರ್ಸ್ ಹಾಕಿರ್ತಾರೆ ಪ್ರೆಗ್ನೆನ್ಸಿ IVF ಟೈಮ್ ಅಲ್ಲಿ, ಬಿಕಾಸ್ ಆಫ್ ಇನ್ಕ್ರೀಸ್ ಮೆಡಿಸಿನ್ಸ್ ದಟ್ ವಿ ಯೂಸ್. ಬಿಕಾಸ್ ಆಫ್ ಬ್ಲಡ್ ಥಿನ್ನರ್ಸ್ ಆಲ್ಸೋ ಕೆಲವರಿಗೆ ಸ್ವಲ್ಪ ಬ್ಲೀಡಿಂಗ್ ಕಾಣಿಸ್ಕೋಬಹುದು. ಸೊ ನಾವು ಆ ಡೋಸ್ ನ ರೆಡ್ಯೂಸ್ ಮಾಡಿ ಮತ್ತೆ ಸಿಂಪಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಮೂಲಕ ದ ಬ್ಲೀಡಿಂಗ್ ಕ್ಯಾನ್ ಬಿ ಸ್ಟಾಪ್ಡ್. So many a times we see IVF pregnancies ಅಲ್ಲಿ small, which you called as threatened miscarriage, ಅಂದ್ರೆ small bleeding ಕಾಣಿಸ್ಕೋಬಹುದು, but that is very simple techniques ಇಂದ ಅದನ್ನ ಕಂಟ್ರೋಲ್ ಮಾಡ್ಕೊಂಡ್ರೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆರಾಮಾಗಿ ಕಂಟಿನ್ಯೂ ಆಗಿರೋದು ಸಹ ನಾವು ನೋಡಿದೀವಿ. ನಥಿಂಗ್ ಟು ತುಂಬಾ ಗಾಬರಿ ಆಗುವಂತದಿರಲ್ಲ, ಬಟ್ ಡೆಫಿನೆಟ್ಲಿ ಆ ಸ್ಮಾಲ್ ಬ್ಲೀಡಿಂಗ್ ಬಂದಾಗ ಯು ಶುಡ್ ಗೋ ಅಂಡ್ ಗೆಟ್ ಯೋರ್ ಸೆಲ್ಫ್ ಚೆಕ್. ಅದ್ರ ಜೊತೆಗೆ ಸೆಕೆಂಡ್ ಮೋಸ್ಟ್ ಕಾಮನ್ ಕಾಸ್ ಈಸ್ ಥೈರಾಯ್ಡ್ ಅಬ್ನಾರ್ಮ್ಯಾಲಿಟಿ. ಕೆಲವು ಸತಿ ಇಫ್ ದ ಥೈರಾಯ್ಡ್ ಇಸ್ ವೆರಿ ಹೈ ಪೋಸ್ಟ್ ಕನ್ಸೆಪ್ಷನ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆದ್ಮೇಲೆ ಥೈರಾಯ್ಡ್ ವೇರಿಯೇಷನ್ಸ್ ವಿಲ್ ಹ್ಯಾಪನ್ ತುಂಬಾ ಜನಕ್ಕೆ. ಸೊ ಅಂತವರಲ್ಲಿ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಥೈರಾಯ್ಡ್ ಟೆಸ್ಟ್ ಮಾಡಿ ನೋಡ್ಕೊಳ್ಬೇಕಾಗುತ್ತೆ ಏನಾದ್ರೂ ಅಬ್ನಾರ್ಮ್ಯಾಲಿಟೀಸ್ ಇದೆಯಾ ಅಂತ. ಸೊ ಅದನ್ನ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಕರೆಕ್ಟ್ ಮಾಡ್ಕೊಳ್ಬೇಕಾಗುತ್ತೆ. ಅಥವಾ ಬೇರೆ ಏನಾದ್ರೂ ಇಮ್ಯುನಲಾಜಿಕಲ್ ಕಾಸಸ್ ಅವ್ರಿಗೆ ಫಸ್ಟೇ ಇದ್ದು ಅದನ್ನ ಐಡೆಂಟಿಫೈ ಮಾಡಿದ್ರೆ ಅದನ್ನ ಥ್ರೂ ವೇರಿಯಸ್ ಮೆಡಿಸಿನ್ಸ್ ಕಂಟ್ರೋಲ್ ಮಾಡ್ಕೋಬಹುದು. ಸೊ ಅಫ್ಕೋರ್ಸ್ ಸರ್ಟೆನ್ ಟೆಸ್ಟ್ ಮಾಡಿ ನೋಡ್ಬೇಕಾಗುತ್ತೆ. ಅದೆಲ್ಲ ನಾರ್ಮಲ್ ಇತ್ತು ಅಂದ್ರೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಕಂಟಿನ್ಯೂ ಆಗೋದಕ್ಕೆ ಯಾವುದೇ ರೀತಿ ತೊಂದರೆ ಇರೋದಿಲ್ಲ.
Thank you, madam. Madam, next question, listed question comes to you itself. Does couple's choice of selecting the fertility center influence the success of an IVF procedure?
Yes, sir. So all these time we were talking about what are the factors related pertaining to the patient parameters, like whether the wife or husband, what parameters can affect the pregnancy rates of IVF. Similarly, even the IVF center also has significant impact on the pregnancy, on the success of IVF. That is because of the through the lab working condition, how well the lab is being maintained, because that is the outside womb which we are providing for the embryo. If so, the parameters in the lab, such as the air quality, the kind of incubators that is being used, and whether the regular auditing is happening, or various parameters that we check. So all those things play a significant role on giving the highest pregnancy rate to the patients. So only in centers which have a standardized lab where all international standards have been maintained, such labs will definitely lead to a higher pregnancy rates. Otherwise, if the lab condition is not well maintained or it is not checked very regularly, the pregnancy rate can drop down to more than less than 30% also. So it is very important for any patient to choose a right lab where where they have an in-house embryologist, where the lab parameters have been regularly checked, have a systematic protocol in such particular centers, will definitely lead to a better pregnancy rates. As in Garbhagudi, so we have regular checkups where our lab team is on regular auditing. So their quality is checked every 15 to every month. So by these, by maintaining all these things, we maintain the highest standards for the embryo culture.
Thank you, madam.
So just wanted to add a few more things. As Dr. Chinmay had clearly emphasized, these are the main things. Other things what I've come across with my experiences, couples come and they ask that center is giving me this much result, that center is offering so much package. So what they need to understand is when there is too much of cost cutting happening, there are some inferior products which are being selected. Okay, so it's very important to be in the correct center. Like there are lots of steps where things can go wrong. There are injections which are good quality, established, good efficacy. So when we use those, the cost comes high and results are also good. But when lower cost injections are used, the results are not so good. Similar with the equipments in the lab, whatever equipments, the media which are used, they have to be very, very standardized and very strict quality checks have to be done. So when we do all those things and we, that all ensures like success rates. So it's very, very important to go for centers which do not compromise their quality for the cost. And whenever cost cutting is happening, please be assured that there is compromise in quality, more so where centers which do batch IVF and those who do not have full-time embryologists, those things are not done here. We have full-time embryologists. We do all individualized protocols. Every treatment is catered and individualized and personalized for the patient's particular factors. So that is very important in IVF success.
Awesome. Thank you. Thank you for those additions. Chinma madam, Kannada speaking population nalli ನೀವು ತುಂಬಾ ಪಾಪ್ಯುಲರ್ ಆಗಿದೆ ಅಂತ ಕಾಣಿಸುತ್ತೆ. ಒಂದು 3 ಕ್ವೆಶ್ಚನ್ಸ್ ಇದೆ ಮೇಡಮ್. ಇನ್ನೊಂದು ಕ್ವೆಶ್ಚನ್ ಏನಿದೆ ಅಂತಂದ್ರೆ ಚಿನ್ಮಾ ಮೇಡಮ್ಗೆ, ಮ್ಯಾಮ್ ನನಗೆ ಯೂಟ್ರಸ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿದ್ದಾರೆ. ನಿಮ್ಮ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಮಾಡ್ತೀರಾ? ಪ್ಲೀಸ್ ಹೇಳಿ.
ಸರ್, ಈಗ ಯೂಟ್ರೈನ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡಬೇಕು ಅಂದ್ರೆ ವಿ ನೀಡ್ ಅಡ್ವಾನ್ಸ್ಡ್ ಸರ್ಜನ್, ಲೈಕ್ ವಿ ನೀಡ್ ಅ ವ್ಯಾಸ್ಕ್ಯುಲರ್ ಸರ್ಜನ್, ಮತ್ತೆ ಒಬ್ರು ICU ಬ್ಯಾಕಪ್ ಇರಬೇಕಾಗತ್ತೆ. So since we don't have that facilities, it is not done in Garbhagudi, sir. Right now we are not doing uterine transplant here.
Thank you, madam. ಇನ್ನೊಂದು ಕ್ವೆಶ್ಚನ್ ಇದೆ. ನಾನು IVF FROT ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಆಯಿತು, ಬಟ್ ನನಗೆ ನೆಗೆಟಿವ್ ಬಂತು. ನೆಕ್ಸ್ಟ್ ನನಗೆ ಈಗ ಟ್ರೀಟ್ ತಗೋಬೇಕು ಮ್ಯಾಮ್. ನಾನು ಫ್ರೋಸನ್ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಸಕ್ಸಸ್ ಆಗೋಕೆ ನನಗೆ ಎಂಡೋಮೆಟ್ರಿಯಾಸಿಸ್ ಇದೆ, ಟ್ಯೂಬ್ ಬ್ಲಾಕ್ ಇದೆ, ಏನ್ ಸಜೆಸ್ಟ್ ಮಾಡ್ತೀರಾ?
ಸೊ ಅವ್ರಿಗೆ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್ ಇರೋರ್ಗಲ್ಲಿ ಕೆಲವು ಸತಿ ಇಂಪ್ಲಾಂಟೇಶನ್ ಅಂದ್ರೆ ಭ್ರೂಣ ಅಂಟ್ಕೊಳ್ಳೋ ಕೆಪಾಸಿಟಿ ಸ್ವಲ್ಪ ಮಟ್ಟಕ್ಕೆ ಕಮ್ಮಿ ಇರಬಹುದು. ಬಟ್ ಅದನ್ನ ಇಂಪ್ರೂವ್ ಮಾಡೋದಕ್ಕೆ ನಾವು ವೇರಿಯಸ್ ಟೆಕ್ನಿಕ್ಸ್ ಮಾಡ್ತೀವಿ. ಒಂದು, ಈಗ ನೆಗೆಟಿವ್ ಬರೋದಕ್ಕೆ ಏನ್ ಕಾರಣಗಳಿರುತ್ತೆ ಅಂತ ನೋಡ್ಕೊಳ್ಬೇಕಾಗತ್ತೆ. ಒಂದು, ಅವ್ರದ್ದು ಎಂಡೋಮೆಟ್ರಿಯಲ್ ಲೈನಿಂಗ್ ಚೆನ್ನಾಗಿ ಬಂದಿತ್ತಾ, ಅದರಲ್ಲಿ ಬ್ಲಡ್ ಸಪ್ಲೈ ಚೆನ್ನಾಗಿತ್ತಾ, ಮತ್ತೆ ಕೆಲವು ಸತಿ ಎಲ್ಲಾ ಬೆಸ್ಟ್ ಆಗಿದ್ದು ಈವನ್ ಬೆಸ್ಟ್ ಭ್ರೂಣ ಹಾಕಿದ್ರು ಸಹ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಗಿಲ್ಲ ಅಂದ್ರೆ ಅಂತವ್ರಿಗೆ ಎರಾ ಅಂತ ಒಂದು ಟೆಸ್ಟ್ ಮಾಡ್ತೀವಿ. ಅಂದ್ರೆ ನಾವು ಯೂಶಲಿ ಈಗ ಡೇ 5 ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡಿದ ಟೈಮಲ್ಲಿ ಅವ್ರ ಗರ್ಭಕೋಶ ಅದರ ಎಂಬ್ರಿಯೋನ ಅಕ್ಸೆಪ್ಟ್ ಮಾಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ರೆಡಿ ಇತ್ತಾ ಇಲ್ವಾ ಅಂತ ತಿಳ್ಕೊಳ್ಳೋದು. ಆ ಟೈಮಿಂಗ್ ಏನಾದ್ರೂ ಶಿಫ್ಟ್ ಆಗಿದ್ರೆ ಅದನ್ನ ಕರೆಕ್ಟ್ ಮಾಡಿದಾಗ ಅವ್ರ ಪ್ರೆಗ್ನೆನ್ಸಿ ರೇಟ್ಸ್ ಇನ್ಕ್ರೀಸಸ್ ಬೈ 80%. ಅಂಡ್ ಆಲ್ಸೋ ಬೇರೆ ಏನಾದ್ರೂ ಕಾರಣ, ಇಮ್ಯುನಾಲಜಿಕಲ್ ಕಾಸಸ್ ಇದೆಯಾ, ಈಗ ಅವ್ರಿಗೆ ಎಂಡೋಮೆಟ್ರೋಸಿಸ್ ಇರೋದ್ರಿಂದ ಅಂತವ್ರಿಗೆ ನಾವು ಡೌನ್ ರೆಗ್ಯುಲೇಟೆಡ್ ಫ್ರೋಸನ್ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಅಂತ ಮಾಡ್ತೀವಿ. ಸೊ ಆ ತರ ಮಾಡಿದಾಗ ಅವ್ರಿಗೆ ಸಿವಿಯರಿಟಿ ಆಫ್ ಎಂಡೋಮೆಟ್ರಿಯೋಸಿಸ್ ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಅದರಿಂದ ಬಂದಿರೋ ಪ್ರಾಬ್ಲಮ್ಸ್ ಅಂದ್ರೆ ಎಂಬ್ರಿಯೋ ಅಂಟ್ಕೊಳ್ಳಕ್ಕೆ ಆಗೋ ತೊಂದರೆಗಳನ್ನ ಸಹ ಕಮ್ಮಿ ಮಾಡಿಕೊಂಡು ಬೆಸ್ಟ್ ಎಂಡೋಮೆಟ್ರಿಯಂ ಬಂದಾಗ ನಾವು ಭ್ರೂಣನ ನೀಟಾಗಿ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡಿದಾಗ ಖಂಡಿತವಾಗ್ಲೂ ಅವರಿಗೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಗಬೇಕು. ಅಂಡ್ ಸೆಕೆಂಡ್ಲಿ ಎಂಬ್ರಿಯೋ ಕ್ವಾಲಿಟಿ ಹೇಗಿದೆ ಅಂತ ನೋಡ್ಕೊಂಡು ಅವ್ರು ಇನ್ನೊಂದ್ಸತಿ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡಿಸ್ಕೋಬಹುದು. ಬಟ್ ಅದಕ್ಕಿಂತ ಮುಂಚೆ ಅವ್ರ ಥೈರಾಯ್ಡ್, ಶುಗರ್ಸ್, ಬೇರೆ ಪ್ಯಾರಾಮೀಟರ್ಸ್ ಏನಾದ್ರೂ ತೊಂದರೆ ಇದೆಯಾ ಅಂತ ಐಡೆಂಟಿಫೈ ಮಾಡಿ ನಂತರ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ರೇಟ್ಸ್ ಹೈ ಇರುತ್ತೆ.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಇನ್ನೊಂದು 2 ಕ್ವಶನ್ ಇದೆ. ನನಗೆ PCOD ಇದೆ ಮತ್ತೆ ಫೈಬ್ರಾಯ್ಡ್ ಇದೆ. ಇವಾಗ PCOD ರಿಕವರ್ ಆಗಿದೆ, ಬಟ್ ಫೈಬ್ರಾಯ್ಡ್ ಇದೆ, ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಗುತ್ತಾ? ಏನ್ ಮಾಡ್ಬೇಕು ಪ್ಲೀಸ್ ಹೇಳಿ.
ಎಸ್, ಎಲ್ಲಾ ಫೈಬ್ರಾಯ್ಡ್ಸ್ಗೂ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಗಲ್ಲ ಅಂತ ಹೇಳಕ್ಕಾಗಲ್ಲ. ಸೊ ಇಟ್ಸ್ ಓನ್ಲಿ ಅ ಸ್ಮಾಲ್ ಗ್ರೂಪ್. ಅಂದ್ರೆ ಈಗ ಫೈಬ್ರಾಯ್ಡ್ ಸೈಜ್ 4 ಸೆಂಟಿಮೀಟರ್ ಅಥವಾ 5 ಸೆಂಟಿಮೀಟರ್ ಗಿಂತ ದೊಡ್ಡದಿದ್ರೆ, ಅಥವಾ ಫೈಬ್ರಾಯ್ಡ್ ಲೊಕೇಶನ್ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಗರ್ಭಕೋಶದ ಯಾವ ಭಾಗದಲ್ಲಿ ಫೈಬ್ರಾಯ್ಡ್ ಇದೆ ಅನ್ನೋದು ಇಂಪಾರ್ಟೆಂಟ್ ಆಗುತ್ತೆ. ಈಗ ಗರ್ಭಕೋಶದ ಒಳಭಾಗ ಒಂದಿರುತ್ತೆ, ಗರ್ಭಕೋಶದ ಮಧ್ಯದ ಭಾಗ ಮತ್ತೆ ಹೊರಭಾಗ. ಯಾವುದೇ ಫೈಬ್ರಾಯ್ಡ್ ಹೊರಗಡೆ ಭಾಗದಲ್ಲಿ ಇದ್ದಾಗ ಅದರಿಂದ ಪ್ರೆಗ್ನೆನ್ಸಿಗೆ ತೊಂದರೆ ಬರೋ ಸಾಧ್ಯತೆ ಇರೋದಿಲ್ಲ. ಕಂಪ್ಲೀಟ್ ಒಳಗಡೆ ಭಾಗ ಅಂದ್ರೆ ಕ್ಯಾವಿಟಿ ಒಳಗೆ ಇರೋ ಫೈಬ್ರಾಯ್ಡ್ ಅಥವಾ ಸಬ್ಮ್ಯೂಕೋಸಲ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ಅಂತ ಕರಿತೀವಿ. ಈ ತರ ಸಬ್ಮ್ಯೂಕೋಸಲ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ಇರೋರಲ್ಲಿ ಖಂಡಿತವಾಗ್ಲೂ ಆ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ನ ರಿಮೂವ್ ಮಾಡಿಸ್ಕೋಬೇಕಾಗುತ್ತೆ ಥ್ರೂ ಸರ್ಜಿಕಲ್ ಮೆಥಡ್ ಓನ್ಲಿ. ಯಾವುದೇ ಮೆಡಿಕಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್ಗೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಪ್ಲಾನ್ ಮಾಡೋರಲ್ಲಿ ಇಟ್ ಇಸ್ ನಾಟ್ ಬೆನಿಫಿಷಿಯಲ್, ಅಷ್ಟು ಉಪಯೋಗಕ್ಕೆ ಬರೋದಿಲ್ಲ, ಮತ್ತೆ ಮಾಡಿಸ್ಕೊಳ್ಳೂ ಕೂಡುದು. ಅವ್ರು ಥ್ರೂ ಸರ್ಜರಿ ಮೂಲಕ ಆ ಸಬ್ಮ್ಯೂಕೋಸಲ್ ಫೈಬ್ರಾಯ್ಡ್ ನ ಖಂಡಿತವಾಗ್ಲೂ ರಿಮೂವ್ ಮಾಡಬೇಕು, ಯಾಕಂದ್ರೆ ಅದು ಪ್ರೆಗ್ನೆನ್ಸಿನ ಆಗದೆ ಇರೋ ತರ ಮಾಡುತ್ತೆ. ಎರಡನೇದು, ಮಧ್ಯದ ಭಾಗದಲ್ಲಿ ಬಂದಾಗ ಆ ಫೈಬ್ರಾಯ್ಡ್ ಸೈಜ್ ಇಂಪಾರ್ಟೆಂಟ್. ಎನಿಥಿಂಗ್ ಮೋರ್ ದೆನ್ 3 ಸೆಂಟಿಮೀಟರ್ ಅಥವಾ ಫೈಬ್ರಾಯ್ಡ್ ಎಲ್ಲಿ ಭ್ರೂಣ ಕುತ್ಕೋಬೇಕು ಆ ಜಾಗನ ಬಂದು ಅದು ಡಿಸ್ಟಾರ್ಟ್, ಅದಕ್ಕೆ ಒಂದು ನಾರ್ಮಲ್ ಶೇಪ್ ಇರುತ್ತೆ ಗರ್ಭಕೋಶಕ್ಕೆ, ಅದನ್ನ ಕಂಪ್ಲೀಟ್ ಆಗಿ ಹಾಳು ಮಾಡ್ತಾ ಇದ್ರೆ, ಅಥವಾ ಮಲ್ಟಿಪಲ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್, ಈಗ ತುಂಬಾನೇ ಒಂದು 5 ರಿಂದ 6 ದೊಡ್ಡ ದೊಡ್ಡ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ಇದ್ರೆ ಅಂತವ್ರಿಗೆ ಫೈಬ್ರಾಯ್ಡ್ ರಿಮೂವಲ್ ಅವಶ್ಯಕತೆ ಇರುತ್ತೆ. ಕೆಲವು ಸತಿ ರಿಪೋರ್ಟ್ಸ್ ಅಲ್ಲಿ ಸ್ಮಾಲ್ ಸೀಡ್ಲಿಂಗ್ ಫೈಬ್ರಾಯ್ಡ್ ಅಥವಾ ಸಬ್ಸಿರೋಸಲ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ಅಂತ ಹಾಕಿರ್ತಾರೆ. ಅಂತ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ಇರೋರಲ್ಲಿ ವರಿ ಮಾಡ್ಕೊಳ್ಳುವಂತದ್ದಿಲ್ಲ. ಆ ಫೈಬ್ರಾಯ್ಡ್ ಇಂದ ಪ್ರೆಗ್ನೆನ್ಸಿ ಖಂಡಿತವಾಗ್ಲೂ ಆಗುತ್ತೆ. ಜಸ್ಟ್ ಇಂಟ್ರಾಮ್ಯೂರಲ್ ಸಬ್ಮ್ಯೂಕೋಸಲ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ಅನ್ನ ಅವರು ಗಮನ ಇಟ್ಟು ನೋಡ್ಸ್ಕೊಳ್ಬೇಕಾಗುತ್ತೆ.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಪ್ರಿಯಾಂಕಾ ಮೇಡಮ್, ಲೈಕ್ ಒಂದು ಕನ್ನಡದಲ್ಲಿ ಕ್ವಶನ್ ಇದೆ, ಬಟ್ ಇಟ್ ಸೀಮ್ಸ್ ಟು ಬಿ ಅ ಪಾಟೀಲ್. ಅವ್ರಿಗೆ ಹಿಂದಿ ಬರುತ್ತೆ, ನೀವು ಹಿಂದಿಲಿ ಆನ್ಸರ್ ಮಾಡಬಹುದು. ಐ ವಿಲ್ ಪುಟ್ ದ ಕ್ವಶನ್ इन हिंदी itself. मुझे 4.5 cm का सिस्ट है, मुझे बच्चा हो सकता है?
डेफिनेटली सिस्ट सिर्फ होने से ऐसा नहीं होता है कि प्रेगनेंसी होने में प्रॉब्लम होगी. कई बार देखना होता है कि सिस्ट कैसा है, कि बिनाइन है, मतलब उसमें कोई ट्यूमर जैसा लग रहा है या नहीं, या उसमें कुछ कैंसरस फीचर्स हैं या नहीं. तो सिस्ट का क्वालिटी देख के हम अगर स्कैन देख पाए उनका, अगर स्कैन रिपोर्ट हमारे पास शेयर कर सके तो वी कैन गिव एन ओपिनियन कि सिस्ट कैसा है, वेदर उससे कोई प्रॉब्लम होने वाली है कि नहीं. अगर एंडोमेट्रियोटिक सिस्ट है तो डिपेंडिंग ऑन पहले सर्जरी हुई है या नहीं, अभी उनको सर्जरी जरूरत है ना या नहीं, वो हम बता सकते हैं. तो ऑल डिपेंड्स कि सिस्ट का क्वालिटी कैसा है, बाकी फैक्टर्स कैसे हैं, उसके बेसिस पे सर्जरी रिक्वायर्ड और नॉट रिक्वायर्ड दैट वी कैन प्लान. एंड सिस्ट होने से कोई प्रॉब्लम नहीं होती है. देयर आर मेनी सिस्ट व्हिच आर जस्ट फंक्शनल, जो आते हैं और जाते हैं, उसके लिए कुछ मेजर ट्रीटमेंट की जरूरत नहीं पड़ती है, तो उससे फर्टिलिटी पे बहुत ज्यादा इम्पैक्ट नहीं होता है.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಚಿನ್ಮಯ್ ಮೇಡಮ್, ಕನ್ನಡದಲ್ಲಿ ಇನ್ನೊಂದಿದೆ. ನನಗೆ 10 years ಬ್ಯಾಕ್ TB ಆಗಿತ್ತು. ಇವಾಗ ನಾನು IVF ಫ್ರೋಸನ್ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡಿಸ್ಕೋಬೇಕಿದೆ. 1 time ಪ್ರೆಗ್ನೆನ್ಸಿ ನೆಗೆಟಿವ್ ಬಂತು. ನಾನು ಟ್ಯೂಬ್ ಬ್ಲಾಕ್ ಆಗಿದೆ, 1 time ಲೆಪ್ರೋಸ್ಕೋಪಿ ಆಗಿತ್ತು. ಚಾಕ್ಲೇಟ್ ಸಿಸ್ಟ್ ಇದೆ, ಅದು ಎವ್ರಿ ಮಂತ್ ಬರುತ್ತೆ.
ಸರ್, ಈಗ ಇವರಲ್ಲಿ ನಾವು ನೋಡೋದಾದ್ರೆ 2 ಪ್ಯಾರಾಮೀಟರ್ಸ್ ಇದೆ ವಿಚ್ ಕ್ಯಾನ್ ಅವ್ರಿಗೆ IVF ಆಗೋದಕ್ಕೆ ಪ್ರಾಬ್ಲಮ್ ಮಾಡ್ತಾರೆ, ಅಂದ್ರೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಪಾಸಿಟಿವ್ ಬರೋದಕ್ಕೆ ತೊಂದರೆ ಆಗ್ತಾ ಇರೋದು. ಒಂದು, ಅವ್ರಿಗೆ ಪ್ರೀವಿಯಸ್ ಹಿಸ್ಟ್ರಿ ಟ್ಯೂಬರ್ಕ್ಯುಲೋಸಿಸ್ ಇರೋದ್ರಿಂದ. ಸೊ ಈ ಟ್ಯೂಬರ್ಕ್ಯುಲೋಸಿಸ್ ಬಾಡಿಲಿ ಯಾವ ಭಾಗದಲ್ಲಿ ಇತ್ತು ಅನ್ನೋದನ್ನ ನೋಡ್ಕೊಳ್ಬೇಕಾಗುತ್ತೆ. ಎರಡನೇದು, ಅದೇನಾದ್ರೂ ಗರ್ಭಕೋಶಕ್ಕೆ ಬಂದು ಅಫೆಕ್ಟ್ ಆಗಿದ್ರೆ ಅಂತವ್ರಿಗೆ ಗರ್ಭಕೋಶದ ಒಳಪರ್ದೆ ಅಥವಾ ಎಂಡೋಮೆಟ್ರಿಯಂ ಏನ್ ಹೇಳ್ತೀವಿ ಅದ್ರ ಬೆಳವಣಿಗೆ ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಸೊ ಅದು ಅಕಸ್ಮಾತ್ ಇಫ್ ಎಂಡೋಮೆಟ್ರಿಯಲ್ ಲೈನಿಂಗ್ ಏನಾದ್ರೂ ತುಂಬಾ ಕಮ್ಮಿ, ಲೆಸ್ ದೆನ್ 7.5 ಕಮ್ಮಿ ಇದ್ರೆ ಅಥವಾ ಬ್ಲಡ್ ಸಪ್ಲೈ ಕಮ್ಮಿ ಇದ್ದಾಗ ಅಂತವ್ರಿಗೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಆಗೋ ಸಾಧ್ಯತೆ ವಿಲ್ ಬಿ ಅರೌಂಡ್ ಲೆಸ್ ದೆನ್ 30% ಚಾನ್ಸಸ್ ಈವನ್ ಥ್ರೂ IVF. ಬಟ್ ಅದಕ್ಕೋಸ್ಕರ ಹೊಸ ಟ್ರೀಟ್ಮೆಂಟ್ ವಿಧಾನಗಳಿದಾವೆ, ಅಂದ್ರೆ ವಾಟ್ ವಿ ಕಾಲ್ ಎಂಡೋಮೆಟ್ರಿಯಲ್ ರಿಜ್ಯುನೇಷನ್. ಅಂದ್ರೆ ಅದನ್ನ ರಿಜ್ಯುನೇಟ್ ಮಾಡಬಹುದು, ಲೈಕ್ BAPC ಅಂತ ಹಾಕ್ತಿವಿ ಅಥವಾ PRP ಅಂತ ಹಾಕ್ತಿವಿ, GCSF ಹಾಕ್ತಿವಿ. ಸೊ ಈ ರೀತಿಯಾದ ಪ್ರೊಸೀಜರ್ಸ್ ಮಾಡೋದ್ರಿಂದ ಎಂಡೋಮೆಟ್ರಿಯಲ್ ಲೈನಿಂಗ್ ನ ನಾವು ಬೆಳೆಸಿ ಅದರ ನಂತರ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡಿದಾಗ ಪ್ರೆಗ್ನೆನ್ಸಿ ಚಾನ್ಸಸ್ ಆರ್ ಮ್ಯಾಕ್ಸಿಮಮ್ ಆಲ್ಮೋಸ್ಟ್ ಈಕ್ವಲ್ ಟು ಅದರ್ ನಾನ್ ಟ್ಯೂಬರ್ಕ್ಯುಲೋಸ್ ಪೇಷಂಟ್ಸ್. ಎರಡನೇದು, ಮುಂದೆ ಏನೇ ಟ್ರೀಟ್ಮೆಂಟ್ ಸ್ಟಾರ್ಟ್ ಮಾಡೋಕ್ಕೂ ಮೊದಲು ಅವ್ರದ್ದು TB ಕಂಪ್ಲೀಟ್ ಆಗಿ ಗರ್ಭಕೋಶದಲ್ಲಿ ಇವಾಗ ಮತ್ತೆ ರಿಲ್ಯಾಕ್ಸ್ ಆಗಿಲ್ಲ, ಎಲ್ಲ ನಾರ್ಮಲ್ ಇದೆ ಅಂತ ಮತ್ತೆ TB ಟೆಸ್ಟ್ ಗರ್ಭಕೋಶದ ಒಳಭಾಗದಿಂದ ಟೆಸ್ಟ್ ನ ಕಳಿಸಿ ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೋಬೇಕು. ಅದಾದ್ಮೇಲೆ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಪ್ಲಾನ್ ಮಾಡಬೇಕು. ಮತ್ತೆ ಎಂಡೋಮೆಟ್ರಿಯೋಸಿಸ್ ಅದು ಯಾವ ರೀತಿ ಕಂಡೀಷನ್ ಅಂದ್ರೆ ಇಟ್ ಇಸ್ ನೋನ್ ಟು ರಿಕರ್. ಅಂದ್ರೆ ನಾವು ಎಷ್ಟೇ ಈಗ ಒಂದ್ಸತಿ ಸರ್ಜರಿ ಮಾಡ್ಸಿರ್ತೀರಾ, ಸರ್ಜರಿ ನಂತರ ಅದು ಕಂಪ್ಲೀಟ್ ಆಗಿ ವಾಸಿ ಆಗ್ಬಿಟ್ಟಿದೆ, ಲೈಫಲ್ಲಿ ಮತ್ತೆ ಬರೋದಿಲ್ಲ ಅಂತ ಅನ್ಕೊಳಕ್ ಆಗಲ್ಲ. ಕೆಲವ್ರಿಗೆ 1 ವರ್ಷದ ನಂತರ ಬರ್ಬೋದು, ಕೆಲವ್ರಿಗೆ 5 ವರ್ಷದ ನಂತರ ಬರಬಹುದು ವಾಪಸ್ಸು, ಇನ್ ಕೆಲವ್ರಿಗೆ ಬರ್ದಲೇನೂ ಇರಬಹುದು. ಸೊ ಯಾರಲ್ಲಿ ಅದ್ ಮತ್ತೆ ಬರುತ್ತೆ ಅಂತ ಹೇಳಕ್ ಬರೋದಿಲ್ಲ. ಅಂತೂ ಪದೇ ಪದೇ ಸರ್ಜರಿ ಡೆಫಿನೆಟ್ಲಿ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. ಬಟ್ ಥ್ರೂ ಮೆಡಿಕಲ್ ಟ್ರೀಟ್ಮೆಂಟ್, ಕೆಲವು ಮೆಡಿಕಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಅಂದ್ರೆ ಮೆಡಿಸಿನ್ಸ್ ಮೂಲಕ ಸಿವಿಯರಿಟಿ ಆಫ್ ದ ಡಿಸೀಸ್ ನ ಕಮ್ಮಿ ಮಾಡ್ಬೋದು. ಕಂಪ್ಲೀಟ್ ಆಗಿ ಹೋಗ್ಸಲಾಡಕ್ ಆಗಲ್ಲ, ಸಿವಿಯರಿಟಿನ ಕಮ್ಮಿ ಮಾಡಿಕೊಂಡು ನಂತರ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡಿಸ್ಕೊಂಡಾಗ ಪ್ರೆಗ್ನೆನ್ಸಿ ಚಾನ್ಸಸ್ ವಿಲ್ ಬಿ ಮ್ಯಾಕ್ಸಿಮಮ್. ಸೊ ಒಂದು ಅವ್ರದ್ದು TB ಇನ್ನ ಆಕ್ಟಿವ್ ಇಲ್ಲ ಅಂತ ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೊಳ್ಬೇಕು. ನಂತರ TB ಇಂದ ಏನಾದ್ರು ಗರ್ಭಕೋಶದ ಒಳಭಾಗ ಎಫೆಕ್ಟ್ ಆಗಿದೆಯಾ ಅಂತ ನೋಡ್ಕೊಳ್ಬೇಕು. ಗರ್ಭಕೋಶದ ಒಳ ಲೈನಿಂಗ್ ಎಂಡೋಮೆಟ್ರಿಯಲ್ ಗ್ರೋತ್ ಚೆನ್ನಾಗಿದೆಯಾ ನೋಡ್ಬೇಕು, ಇಲ್ಲಾಂದ್ರೆ ರಿಜ್ಯುನೇಷನ್ ಟೆಕ್ನಿಕ್ಸ್ ಯೂಸ್ ಮಾಡಬೇಕು. ಎಂಡೋಮೆಟ್ರಿಯೋಸಿಸ್ ನ ಸಪ್ರೆಸ್ ಮಾಡಕ್ಕೆ ಕೆಲವು ಮೆಡಿಕಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ ಇರುತ್ತೆ, ಅದನ್ನ ಹಾಕೊಂಡು ನಂತರ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡಿಸ್ಕೊಳ್ಬೇಕಾಗುತ್ತೆ.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ವೀಕ್ಷಕರೇ, ನಿಮ್ಮ ಕ್ವಶನ್ಸ್ ಬರ್ತಾ ಇರಲಿ, ಮುಂದಿನ ಗರ್ಭ ಸಂದೇಶದಲ್ಲಿ ಅದನ್ನ ಅಡ್ರೆಸ್ ಮಾಡ್ತೇವೆ. ವಿತ್ ದಿಸ್, as the time is running out, dear viewers, I would like to remind you that due to motherhood celebrations, there is offer going on for the entire month. First free fertility consultation, 20% off on semen analysis for men, 20% off on select blood investigations for women. Please do avail this offer. With this, we come to the close of this episode. Now, I would like to ask Dr. Chinmay and Dr. Priyanka both to conclude today's talk. What do you wish to tell our viewers? How to make IVF successful?
Sir, first and foremost, few things they have to understand. Before going for IVF, nothing is 100% in infertility, but to achieve maximum pregnancy rates, there are various factors which can be corrected prior to IVF. So that needs to be planned properly, be it thyroid, their sugars. These are all simple factors which can impact their pregnancy rates, be it their weight, other habits like smoking, alcohol to be brought down, and then choosing the right center, planning the right treatment at the right age. Earlier the treatment, better the pregnancy chances. Definitely, as when the age is lesser, we have more options and better chances to achieve maximum pregnancy rates.
Thank you. Dr. Priyanka?
So my concluding remarks would be, if the couple want IVF to be successful, it has to be a holistic approach. It cannot be individual approach that only we give treatment and it will work wonders. It doesn't happen like that. The patient has to also contribute equally by making lifestyle modifications, doing regular exercises, following a good diet regime, which should all start 2 to 3 months prior to starting the IVF cycle, taking all the supplements properly, taking all the medications properly, and having with a positive and coming with a positive attitude. That is very, very important. We have time and again seen people or couples who come with lot of positive attitude, faith and zeal that yes, this treatment is going to work out no matter what. Even even moderate quality embryos we've seen doing wonders and they've conceived. But people who come with a negative attitude, they are stressed out, they're depressed, anxiety, all those things, and they do not correct the simple factors like smoking or at least not sleeping enough. All adds to the success of IVF. So when they've not taken care of that, even very good quality embryos don't tend to implant. So we do our part. Even they have to be completely involved in that holistically. And definitely when the lab is strong, everything works together and we can achieve good results. But it has to be an individualized approach. It cannot be compared, like every individual is different. So one patient may achieve success with one cycle, the other may require multiple cycles. So even the couple should not compare their treatment outcomes with the other couples. Why they got success in one cycle, was something not done for me? It is nothing like that. Everyone is given tailor-made treatment, and then the success depends upon multiple factors, is what they need to understand.
Well said, both of the doctors, and thank you, doctors. राघवेंद्र सिंह जी, आपका क्वेश्चन का उत्तर यह है कि हमारा 5 सेंटर है बेंगलोर में, एक साउथर्न सर्कल, एक हनुमंत नगर, एक कल्याण नगर, एक मारथहल्ली और एक इलेक्ट्रॉनिक सिटी। center. ये 5 centers हैं हमारे. Like you can avail all these offers at all these 5 centers. Thank you, Raghvendra Singh ji, and thank you, doctors. Thank you for this
Thank you, sir.
wonderful
Thank
episode.
you.